How you doing today, folks? We're here with our ring removal specialist here at Ring Rescue. Daryl, how you doing today, man?
Great, Blake. Thanks for having me.
Well, it's a pleasure to have you today. So we're here to talk about the different stuck ring situations where a professional is going to have to use the device once versus twice to compress the finger enough to give them the best chance to remove the ring. So Daryl, let's talk about that. When are the scenarios for a professional, whether you're in the jewelry sector, funeral services, or the medical, where you'd use the device for 1 round versus 2 rounds?
That's a really important question, Blake. And I like to try to do my assessment and determine whether it's an acute issue or a chronic issue. And what we mean by acute is it's kind of happened extremely recent or all of a sudden versus chronic, which has been built up over months or years. So an example for that would be acute swelling is your pregnant patient or customer that everything was great, woke up that one morning, has the big swollen fingers from the fluid retention. That just happened. That's an acute related case. The majority of those cases we're going to be able to get by with 1 round because that's just a lot of fluid. We're going to be able to compress and displace that fluid, shrink the finger, and remove the ring. Versus a chronic issue, which would be the ring hasn't been off in 10, 20, 30 years, and it's been a weight gain issue versus that acute swelling or fluid retention. So you have the weight gain issues, you have the long-term effects. That's going to require multiple applications, and we would recommend attempting two compression attempts before attempting removal of the ring.
So you think that's important for the professional to articulate that to the patient or the customer before they begin?
Yeah, one of the early questions I always ask the patients or the customers is when did you last have the ring off?
Right.
And they say it was off 2 or 3 days ago. I apply the device. I know that it's acute injury or acute swelling. I apply it in a 5-minute timeline. Take that ring off, and it's usually pretty easy to remove. Versus that person that says, it was 15 years ago I last had my wedding band off, I've had 50 pounds of weight gain. That's not a fluid related issue, that's a weight related issue. It's fat, it's increase in bone size. It's a harder removal, so it's going to take more time. So you want to be slow and steady with it, set yourself up for success, so you're going to actually want to do that second compression before you attempt to remove the ring.
Well, there you have it, folks. There's the reason why in certain cases you go 1 round with our device versus 2 rounds. First 1 round would be displacing fluid, 2 rounds would be actually compressing tissue, correct?
Absolutely.
There you have it, folks. Daryl, Blake, we'll be back again. See you later.